Hello, everyone. Welcome to the Dr. Sophia ObGyn Podcast. I'm an ObGyn practicing for over 15 years in my native New York City, and I love to help women learn about their bodies, empower them, and embrace themselves. On this podcast, we talk openly and with heart about all things affecting women, from pregnancy, menopause, periods, sexual health, fertility, and so much more. Disclaimer: this is general medical information based on my professional opinion and experience. For specific medical advice, please refer to your physician. Hello, everyone, and welcome to the Dr. Sophia ObGyn Podcast. I am just so excited to share with you a topic that is near and dear to my heart: perimenopause, menopause. And in today's episode, we get to talk to Touseef.
Moi.
This is the third installation on Touseef on HRT.
Yes. Hello, everybody. So today I am the semi-star of really focusing on HRT. If you have been listening to us since the past about year and a half, we started these installations where I'm 53 and I was wondering if HRT was good. So if you're interested in hearing where it actually started, the first episode where we started to talk about my journey Touseef on HRT was episode 12, where we are actually just talking. I just had tons of questions, because I always do, on whether or not HRT would be good for me. And then after that, we had a second installment, which was episode 28, Touseef on HRT number 2, where we actually looked at the labs. So I actually went and did all the lab work, the blood work, to see all the different aspects of HRT, hormones, and of the sort, to then figure out if I should go on HRT. And then at the end of that, we made a decision that I would go on HRT. So I'm glad to report that I have been on HRT now for about 7 to 8 months. So we thought this would be a good time to do the third installment, Touseef on HRT number 3, in terms of my experience. So I come back bearing fruit of this journey.
Fantastic. So, HRT, hormone replacement therapy, has been getting a lot more exposure. I think people have a lot more questions. All in all, because I think women in general, we have entered this fantastic cohort now of really fabulous women who've entered into perimenopause and menopause, who have become champions of talking about it.
Like public figures.
Celebrities, artists, sportswomen, women in medicine, who have really taken this by the helm in order to bring awareness around menopause and perimenopause. And so
people like Oprah, Halle Berry,
Drew Barrymore. Mm-hmm. And so women who we look up to are giving their real lived experience. And so I think that by you and I talking about it as the regular people, I think it just brings it home that it affects all of us, right? This is not just the celebrities who are getting some special fancy cocktail or a different type of information, right? This information is for all of us. This information is for any woman and every woman.
And the treatment is also accessible for everyone.
Exactly. It's like we are all in the same boat, and we don't have to be some fancy person in, a lofty place in order to feel a sense of community. Mm-hmm. And so I'm so proud of you for us sharing.
Yes,
Thank you.
Absolutely. At this point in the podcast, I'm a total open book. So that's just how it goes. So before I start to talk about it, what is HRT and why do people usually use it?
So when we're talking about the perimenopause transition or menopause itself, meaning you've gone through a full 12 months, no period, that is when your body has had a steep decline in hormones. And that is at a steady place when we're in menopause. Your hormones are very low. And the hormones we're talking about are estrogen, progesterone, testosterone, thyroid certainly plays a role. So there are a couple of different hormones that we're talking about, but
So basically, when your period stops, which is in your early 50s, all those hormones that you just called out, they all drop and they stay there.
They definitely, well, certainly estrogen, progesterone, and testosterone, yes.
So just to recap real quick, in episode 12 and 28, basically where we landed is I went into menopause at age 51. I'm 53 now. And it's not like I had ridiculous amounts of effects in terms of symptoms of menopause, but I did have a little bit of extra weight gain. I did a very little have night sweats and hot flashes. I didn't really have that. I did notice that I would have a tendency to be more tired, and I was wondering, is it age? But, I'm 53. But anyways, you try to figure out, is it really this or that? And then I did notice sometimes that I would have brain fog. Like all of a sudden, I just would have difficulty to concentrate, which is not me. I've always been really sharp without coffee. That's just how my brain works. I'm very blessed. Love my brain and my body. So there were a couple of things. And also we looked at my medical family history. And my father passed away from Alzheimer's, and my mom has some heart conditions.
Right.
So considering all these elements, we came to the conclusion by looking at my family history and also seeing that there's no breast cancer history and my mammograms are clear, and also the fact that I am fully invested in living a 150% full on life right now. Things are popping and I need to be on, and I'm sucking the marrow out of life. Not that I didn't before, but now I'm even at a higher level, that HRT would make sense for me.
Right. And I just want to even clarify even one other thing, because even a family history of breast cancer does not preclude someone from being able to start HRT.
Okay.
And even if they have a personal history of breast cancer, it really needs to be an individualized conversation with their provider. It really depends on what type of HRT they may need, if they need it. There are so many different symptoms that occur in terms of perimenopause, menopause. One of them, let's say, being vaginal dryness or the vaginal symptoms that can happen due to menopause, where HRT that's specifically geared towards the vagina, for example, may still be an option, even for someone who's had breast cancer. So I know that cancers, period, the minute we hear that, was probably the number one reason why everyone was completely turned off to HRT in the first place, from, having had that be one of the results of an increased risk of cancer, breast, and specifically from the Women's Health Initiative.
Which was a study that was done about 20 years ago.
Right.
On HRT that gave all the bad rap.
That gave HRT a bad rap.
Yeah.
Exactly. But the reanalysis of both that study and so many studies that have come after it really shows that HRT does have a role in a woman's life in perimenopause and menopause. And the closer you start that hormone replacement, closer you start it to your menopausal journey, basically.
Basically, the earlier after you've gotten to menopause, the better.
Yes.
Okay.
Exactly.
Okay.
Exactly. And so in your particular case, you were having the brain fog and just feeling like not as sharp as you usually are, plus the fatigue, plus the weight gain.
And then the body wasn't moving as the way that it used to move. But then I was like, is that age? Is that menopause? I wasn't too sure. It just felt like a little squeaky.
Right. Right. And that's actually, it's interesting because that's one of the symptoms that women don't necessarily associate with menopause, the concept of either joint pains or just body aches. Mm-hmm. And so, after we talked about it, you were like, oh, is that possible? And knowing that you want to live this very active life, like fully invested in life, made me think, I think it's important for us to have this conversation about HRT. I think it's important for you to know that this is an option for you in order to help mitigate some of the symptoms you were feeling, and that it's in a very safe way.
So I will say, like, from my perspective, I wasn't sure at the beginning, like, should I go on HRT? Because I'm quite a healthy woman. I'm not on other medications. I don't want to take pharmaceuticals just because they're there. Like, I want to make sure that I need it. So I've always been like that. I've worked in pharmaceutical marketing for many years. So I'm always like, okay, do I really need this? Like, is there other options? Da, 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 da. And so that was one thing. And the second thing was I needed to understand better that study that gave such a bad rap, and then realized that there was just a lot of elements that rendered it like not a very well-designed study for the conclusions that they arrived. There was a lot of biases.
That's correct.
That were inserted in there. So that was the second thing. And the third thing was this notion of, I don't know if it's even like aging gracefully, but it's more like, well, isn't this how the body is supposed to evolve? And why am I messing up with the way that the body has always evolved for women? Like, I guess this is supposed to be normal. So why am I interfering with it? And then after a lot of conversations and really looking at what do I want in my life, and I said, girl, I am not done yet. I have got
You're not done yet.
I am so not done. Like, I am just like starting again. Okay.
Yes.
Like from zero again, but like the zero is much higher, but it's still a zero. And I'm like, no, I just want to. And so by looking at all of these aspects and looking at just, how much little or no risk there is, and almost just recognizing it's okay for this HRT to help me have even greater agency and greater energy and vitality for what I want in my life. I was just like, okay, then I just have to do it. And so that was sort of a little bit my process, but it didn't happen overnight. Like, I remember even in the first episode we did, and you were giving me all the facts, and I was pushing back on a couple of things. So I wasn't like even fully convinced. Then I said, okay, well, this is all good information, but I still don't know if I'm going to do it.
Yeah, I remember.
Yeah.
I remember. I think the beauty of it, though, is unlike if you were someone who was, let's say, a really bad diabetic or has high blood pressure, where medication really can change your life in the sense of real management of those things, especially in someone who it's difficult for them to do some of the lifestyle changes that may aid in improving those medical conditions, right? That taking medication can really help. And then that once they're on it, I don't want to say they're going to be on it forever, but like at least for some time, they would need to be on it, at least while they're working on other things, right? The difference here is that by starting or being on HRT, one can try it and do it like as a trial. You're not committed to this forever. You don't have to feel stuck doing it. But the beauty of it is if you notice the difference, if you see the change, you feel better with some of the symptoms that you're having, you feel better with how you feel in your body, then you can always continue. But you can just take it as a trial period. And I
think when you go to the gym, you do a trial period.
You're doing a trial,
You're
we're
testing it out.
Testing it out. And I think that's a big difference in how we can approach it.
What is the prescription that you gave me?
So I gave you an estrogen or estradiol patch. And
patch, basically, it's like a little sticker that I put like around my waist, hip area.
Yes, like a Band-Aid kind of.
Yeah, it's very small.
It's very small, and you change it twice a week. And we also gave you progesterone.
Yes.
And we gave you that as a capsule.
Yes.
That you take at night.
Yes.
Okay.
So that's what was prescribed. So, a patch and then a pill every night. So, okay, that's all right. So then I started to do that. I was just like, okay, I feel fine. I feel good. I mean, I feel normal. And then as time went by, I felt fine. I felt okay. But it's almost like, like when you're feeling good, you don't notice it anymore. Like sometimes I've noticed, like, like let's say you have a little paper cut, and then every time you feel it. But then when you don't have a paper cut, or any cut for that matter, it's almost like you don't feel anything. Well, you don't feel anything, so you don't think about anything, right? Like that's maybe our default. And it's like I was just like walking, getting up, working. And then it was literally when I said, oh my God, I don't have brain fog. Like it's not even, because I've realized after like a couple of weeks, it's not something that's, oh, I don't have brain fog. You just function in the world, right?
Yeah,
and I'm used to functioning at 150 miles an hour. So I'm just doing the motions. I'm not thinking, oh, I'm much better, because that's how I've always been. So I went back to how I was. I didn't even recognize that it was better until I actually said, oh my God, the brain fog is gone for the last like 3 weeks. And that was a huge shocker for me. Like I was like, okay, I guess this thing is working.
Maybe she's onto something.
So I was shocked about that. And then the other thing that took a little bit longer is I was going up and down the stairs. I live on the second floor, but I go to the gym, whatever. But I went up and down the stairs, and again, it was like a surprise. I went, oh wow, my joints, they don't hurt anymore. I mean, I feel like my joints hurt for at least like 3-4 years, but they were so omnipresent. They were so there all the time that it's just part of your life, right? You don't even feel them anymore.
Mm-hmm.
And so then when it switches back to like nothing, then your body just goes la-di-da-di-da-di-da. But then when you actually pause and actually say, oh my God, I don't have joint pain. So it's just like magic for both things. I'm like, it's just, that's it. That's gone.
Just gone?
Just gone. So those two things were striking to me. And then I don't feel tired anymore. Like I wake up and I'm on, and then I'm focused, and my brain is my ally. I tell it what to do and how we need to focus, and it produces like we're on the same team again. It's quite spectacular, I have to say. I said, all right, come see, come side, it'll get a little better,
Yeah.
But it is quite a substantial difference. And then the other thing, which I was not expecting, is I was losing some eyebrows. The eyebrows are back. I don't know, is that HRT? I was like, and I guess everything is becoming more into balance, or not balance, but the hormonal estrogen, progesterone is at a very low level. And now it is at a level that helps with all these different functions of the body.
That's right.
To actually do what it always did before.
That is correct. I like to remind people all the time, estrogen has 400 functions in your body. Like literally 400. Let's say it together. 400.
And the 400 is not just at the level of your vagina. Because that's a problem, I think, when we think about HRT and we think about hormones. We think that everything is happening, in the lower part of your abdomen.
But it's not.
Meanwhile,
it's not just
it's
in
not.
your, it's not just a part of your reproductive,
right,
organs or what have you. Estrogen has major functions in your brain, like major functions in your brain. Estrogen has major functions in your bones, major functions in your heart, major functions in your skin. The other day you told me you're glowing because you're glowing.
I mean, this is just how my skin looks. And also my hair my hair was always thick, but it's like I'm losing less hair that I've noticed.
Yeah.
So it's just a fortified Touseef, It's just like I wasn't
Let's hold you back.
It's just yeah. And so it enables me to do the things that I want to do. One of the things that sort of like where I wasn't sure of getting on HRT, which was if I'm on it for a couple of years, let's say, when I get off it, am I going to have repercussions? Is the body going to have some negative effects because now it was used to it and now it's not? But you said,
No, what happens is you will revert to who you were before HRT. There's no real magic necessarily to it, but it's not necessarily a negative repercussion. It's you started it, you used it. If you decide to stop, your body will just go back to what it was. HRT, one of the things that I like to remind people even, or just let people know, not even a reminder, but to let people know, is that the hormone replacement that we're doing when it comes to HRT is even less hormones than one would take if they were on a birth control pill.
can you say that again?
That the hormones that we prescribe when it comes to HRT are actually even less in terms of like dose than we would prescribe in a birth control pill.
And we don't think twice for a birth control pill.
Not even for 2 seconds. We don't want babies. We're clear. Let's take a pill.
And nobody talks about the level of hormones. They just say, just get on the pill.
Yeah.
Nobody talks about
Yeah.
the hormone level.
Yeah. It's just what it is. And there was a lot of fear mongering around hormone replacement. And for years, for the last 20 years. So there's a big gap between the women who were able to get access and have HRT before this study. Then the study happened, and literally overnight, like 80% of women stopped being on hormones.
And so the way that the hormones work, that was my other like question or just trying to figure out if HRT is for me. What I found out is basically by taking estrogen as a patch and progesterone as a pill, I'm basically just mimicking an increase of both of those hormones to what it was before. And that the mimicking is pretty good.
Yes. Yes. It's like you were coasting. It's like, okay, before menopause, and I'm just giving arbitrary numbers here. Let's say we needed your estrogen level to be 30 so that you're not experiencing hot flashes. You're not experiencing joint pain. You're not experiencing brain fog. And I need your progesterone, let's say, to be 5 so that your uterus is always protected. You're always feeling a sense of calm. You are sleeping well. So I give you estrogen and progesterone back at a level that keeps you at, let's say, 30 of estrogen and 5 of progesterone.
And the body can assimilate the pill and the patch as that is very similar to how the body creates those hormones.
Yes.
Okay.
That is correct.
So that was the other thing I was just like, because, I'm a little bit of a granola Puritan type of person. I'm just like, but I'm ingesting this, and is it going to put a load in my body in terms of like medication? But turns out it's just actually really mimicking the real thing.
That is the goal.
All right. So then we went through all of that, and then I was like, la-di-da-di-da. Fantastic. I love this. Let's continue on this. And then a surprise happened.
Yeah, I remember that. It was more than a surprise, girl.
But the first time was not that. The first time was just, all right, so what we're talking about here is all of a sudden, la-di-da-di-da. And then I go to the bathroom. This was maybe about, I'm going to say maybe a month and a half after. I go to the bathroom. I pull down my underwear, and there's blood. And I was like, hold up, I'm in menopause. Like, what is going on there? And then there was just like, I didn't like freak out. I was just like, this is weird. Unless something is really wrong with my vagina situation or something. I was just really perplexed because we didn't talk about that. And I didn't know that was potentially an effect. And so thank God you're an OBGYN. And so I thank God you're my very good friend. And so I called you and I'm like, girl, this is what's happening. And you're just like chill, cool, moody. You're like, yeah, that's okay. Like that happens. I'm like, really? Okay. And you were basically saying that the body is
basically trying to kind of recalibrate, right? You had an episode or a time frame, I should say, where you didn't have any, these hormones were all the way on the floor. And now over time, we've revved them back up to the level, like I said, of where your body was like, oh yeah, we like being here. And in doing that, it kind of mimicked also this period-like episode that you had.
But it wasn't
guess.
Obviously because there was an egg that came to the
Yeah,
uterus.
no.
I got no more eggs.
Yeah,
that ain't happening. So how does the period then comes to be?
Well, what happens is that your body, like I said, is kind of like readjusting, recalibrating. And in doing that, we sometimes have to even recalibrate the dosing of the estrogen, making sure that you're on enough progesterone and how to kind of work that out. That's one. And then two, when you are a little earlier in your menopause or, even perimenopausal women who also may be on some form of HRT, the body is like, oh yeah, I remember this. Yay, we got some estrogen, let's get a period. Okay. And so, yeah, it's not unusual for a woman who is very early in her menopause and early in her HRT journey to have some kind of bleeding episode.
So it's not because I was thinking, all right, is it irritating my vaginal walls? That's why blood is coming. It's really because the uterus is creating a lining that is similar to what happens to when you don't get pregnant and an egg is there.
Yeah. You had a lining.
So can you explain that? I know I love that story, but can you say what usually happens when a period happens?
So at a regular time when we're getting our periods, basically we're creating this lining over the course of the month.
In the uterus.
In the uterus. So that way our bodies could house a pregnancy. That lining is what's going to feed the pregnancy. We ovulate, we don't fertilize the egg. The lining then is like, oh, we don't need this lining anymore. And the other hormone, progesterone, is in play. And when the progesterone drops, because progesterone actually is also there to help stabilize that lining. But when that drops and estrogen drops, we then shed that lining. But those things are happening in a specific balance, and there's a balancing act there.
Right. So this is like in your 20s, 30s,
20s,
before
30s,
menopause.
before menopause, etc.
The egg leaves the ovary, goes into the uterus, trying to figure out if there's going to be a sperm there to help it become a baby. That doesn't happen. Meanwhile, everything in the uterus is getting ready for the baby. It don't happen. So then what happens is that all that mushy, what you call lining, which is full of blood.
Yes.
That's what actually goes through the vagina, and that's how you get your period.
That is correct.
So in the situation where now I'm in menopause, I'm taking progesterone, just by the fact that I am introducing estrogen and progesterone, it has recreated that lining.
So your uterus is still responding. Let's just put it that way. Your uterus is still responding to that little bit of estrogen and that little bit of progesterone. So there's a little bit of growing pains sometimes with starting HRT or being on HRT. Though we do expect that that can happen, it doesn't happen to everybody. Okay. Some women are able to start HRT and they never have a bleeding episode. Okay. Some women start HRT and they have a bleeding episode. And if you have a bleeding episode, it still means that we need to figure out why, what was happening, what's going on, whether it's through labs, whether it's, someone maybe who has a history of some anatomic issue with the uterus that makes them more likely to have a bleeding episode, something such as polyps or fibroids. And we've gone through this exercise of, what your history is and what we've done in the past. So I knew you didn't have polyps. I knew you didn't have fibroids.
Because she did, she's my OBGYN, so pap smear, she knows everything that's going on inside of me. Yes.
So I just want to make sure that women understand that a bleeding episode doesn't necessarily mean something traumatically wrong is happening. But at the same time, it still requires some form of an investigation, right? Or at least we still need to know, kind of an understanding of why this is happening in that particular individual. Okay. But more than likely, it's just the balancing act that your body is trying to re-equilibrate. And sometimes it requires a change in dose. Sometimes it requires just a little bit more time in order to let the hormones do what they're doing. And so it's just a matter of getting to that point where everything is way back in balance. And then there's no more bleeding.
So then that first time it happened, and so I told you about it. And I think at that time we were doing, I don't think I was having progesterone every day, but the patch was on me all the time. And then eventually we went to every day. And I think the month after is when all hell broke loose down there. I've, when I've had my period, I had my period, a normal period, and then it was like a lighter period. But the flow was just a lot more. And I was like, okay, the flow is great. I told you about it. And then you said, okay. And this is what is interesting to me. And I think it's important for everybody to recognize that this is normal. Like you were kind of playing detective, trying to figure out, okay, this is how your body's functioning here. All right. So what if we change this? Because everybody is reacting differently from one to another, depending on the dose.
Yep.
And it might just take a little bit of time. So I was just like, all right, I trust you. Everything's good. I'm just going to go along. And then it got worse.
Yeah.
And you were just like, keep going. Let's just see what happens. And then I think it was the third or fourth day, girl, I have never seen so much blood between my legs in my life. Like that was the scariest thing ever. Like it was literally coming down like a wave.
Yeah.
Like I wouldn't even like open my legs and I could feel it like coming down. Oh. And I was just like, I don't know even if I want to get up. Like, do I want to get up? Because I don't even know if it went through the seat. I have no clue. I've got some maxi fucking pads on and I have no idea. And I just changed. And so it was quite something. And I'm not a person that, freaks out over blood or anything like that. I'm all right. But then when I went to the bathroom and then I changed it and I put it and it did it again within about 20 minutes. I was with somebody and he looked at me, he goes, "Are you okay?" I freaked out. I literally freaked out. I had never had that before. And I was just like, oh my God, am I hemorrhaging? And, do I need to go to the ER? Then I called you. I'm like, girl, I don't know what's happening. And I'm never like that. And you were just like, okay, well, just sit down for a second. Let's have a chat. And then you asked me how many pads, very sort of objective, how many pads you went through. And all right, you're still not at the limit. So you're okay. You don't have to go to the ER. And I was like, okay, let me just chill out and just sit down. And I just rested. But that was a scary time, I have to say, because I was not expecting it. And I was just overwhelmed by it. And so I think it's important for people to know that there is a time of fluctuations, and that fluctuation can be completely on one end.
Yeah,
in an intense way.
It can be an adjustment period, that's for sure. And I think I'm actually really happy that we're doing this episode. I'm happy that we're doing this episode because I don't want it all to be like, oh, HRT is so glamorous.
Right.
Because I'm sure that we're just not giving full scope. And here we're giving you the real deal. This is the real story.
The lived experience.
The truly lived experience when it comes to HRT. And it does take having a bit of an adjustment period. Now, for me, because I see so many women, right? And then what you were experiencing, imagine you were very fortunate when you went through your perimenopausal transition in the sense that you didn't experience that avalanche period. You didn't experience that crazy heavy periods, kind of wacky anytime, all the time before you get to that last period. But some women experience that, what you had, as part of their perimenopause transition.
And I told you, I said, no way.
Yeah.
I was just like, how is that possible? No way that women are having this all the time. And you're just like, yes. I'm like, how do women do it? How do women do it?
Let me tell you, not only do they do it, they completely normalize it.
It's wild.
That's the other thing. that they start having these crazy heavy periods and they don't even come in until they are severely anemic. So they've been bleeding like this for months and months and months. And so I'm glad that we're doing this kind of an episode where we're showing, I mean, that's women in perimenopause, but we're talking about women even in menopause and on HRT, that they can have an episode of bleeding that is pretty tremendous while your body is adjusting to being on HRT. And in that time, we still have to, like I said, I mean, whether it's to confirm that the woman doesn't have polyps, we're also making sure that you don't have any risk factors or reasons to have abnormal cells inside of the uterus. One thing that progesterone does is it kind of like lets you know if the uterus has something going on.
It's an indicator.
It's an indicator. It likes to find things and it'll let you know also. The other thing is that we just have to balance. We just have to balance it all. And then once we get back into balance, then we're smooth sailing again.
Because let me tell you, I did not have a pad in sight in my apartment because I have not had a period for 3 years. So I was just like, what? I have to go buy pads? So it was just like a whole, like, you know, changing your mindset. Oh,
Yeah.
okay. Like this is part, well, not part of everybody's journey on HRT, but it was mine.
Right.
And that's what I had to do. And so then we changed the dosing.
We changed how you were dosing. Yeah.
Yes. And so then we went every day. And then and it was like a period where it stopped. It finally stopped. And I was just like, hallelujah, everything is fine again. And then after like a typical, like I used to be 28 days, around the 28th day, I started again, but it wasn't as much. And this lasted little by little, but over the course of about 5 months. And I was just like, are we sure that we want to have me take the progesterone every day? What if we just take it once every second day? Because in my mind, if you reduce it, then I'm not going to have the period. And if I'm having the period, it means my body's in stress or it's not normal. So, you know, I always like read and everything. So I'm always trying to figure out stuff. And so it was great to like talk to you and you were just like, just stay on the regimen. Everything is fine. The fact that it's reducing in quantity and number of days and the intensity of the flow, it means your body is just taking longer.
I want women to walk away. First of all, HRT, there's so many benefits. But yes, is there going to be either an adjustment period? Is there going to be a balancing act? Is there going to be maybe, and it doesn't mean that it's even for everybody. You know, for some women, it may make them become emotional or have an opposite effect than what we intended to. Or we have to change the way in which they take their progesterone. Instead of it being as a capsule that they take at night by mouth, maybe we have to change the way in which they take it. It's still as a capsule, but maybe it's a vaginal capsule. Like there's just a lot of different ways in which we have to do this in order for it to make sense so that you're not just feeling better, but also that it doesn't create some other bothersome side effect.
So it's like you have to check your family medical history, then you have to check your own medical state.
Yeah.
And then when you start trying it, some people, it will work very well without any effects. Some people, and you know, they don't need any like fluctuation changes or anything like that.
Right.
Some people, it will be beneficial like me, but there's like some period where you need to figure out how to balance everything.
Right.
And then there's some people where they're on it, but it might not benefit them fully.
Right. And we have to come up with a different plan. And HRT is not everything. There's still, I mean, we talk about this too. Are you on your supplements? Are you exercising? How are you eating? It doesn't work in a vacuum.
Right. By the way, I'm doing all those things. So that's why it's working for me. So yes, I am also working on all the other cylinders at the same time.
Right.
Yeah.
Right. And all that's going to do, if you're working on all those other things, is help your HRT to work even better for you.
So on that note, now it's been like about 8 months. And I know we talked about it a little bit at the beginning, but how long can I be on this?
You can be on this for as long as you want to be. 5 years, 10 years, 20 years, never come off of it. You decide.
Like some people think, after a while, it might have some negative effects. So there's none of that.
I want to be very careful with how I say this. And the reason why is because there's just so much. Let's just look at you as an individual person and the changes that this has made for you. And knowing I am protecting your heart, I am protecting your bones, I am protecting your brain, the likelihood of you developing Alzheimer's, though we have to do all the things. I've talked to you about your diet. I've talked to you about exercise, moving your body every single day. There is nothing that I can foresee that tells me you need to stop. So you stop when you want to stop. If something should happen, God forbid you develop a cancer. I'm not saying that they are correlated by any means, but I want you to understand one thing. Even in this Women's Health Initiative study, in those women that they did find who had breast cancer, guess what? Those who were on HRT had less invasive cancers. We know that if you develop cancer, that could be your risk regardless, because the reality is that that's a 1 in 8 chance
for any woman.
For any woman, and that's a subject of age.
And predisposition,
family history, etc. And that can fluctuate it up or down. So I want us to think about life in the sense of not fearing it, but rather the desire to have vitality. That's how I look at it. I look at HRT as a way in which women have armed themselves with a way and that they can live a more vital life. And you can do that till you're 80, till you're 90. I remember my mother-in-law, she took her little pill. She's 80 something years old, and she was there taking her little pill every single night. And luckily, she was on HRT before the Women's Health Initiative started, because she's into her 80s now. And so when the Women's Health Initiative started, she'd already gone through perimenopause, menopause, et cetera, and had already been started on hormone replacement. And she was like, no.
It's been a while. It's been for a while.
I've already been using this for a while. No, I'm okay. I'm going to continue. And she's still on it to this day.
So one thing clicked when you were talking to me. I think that in the world of pharmaceuticals and medicines, we have a tendency to think that we are treating a disease. But this is not a disease.
Right.
So in my mind, it just clicked when you were talking. It's true. The way that I'm thinking about it, because, you're prescribing something to me, it's because we want to zap something, or we want to deal with a disease, with a medical issue. This is not a medical issue. This is just how the body is evolving, and that we're trying to maintain a certain level of functioning capacity, vitality that it always was. So it's not a disease. So it's to change the way we even look at, because when somebody prescribes you something, you think it's to address a problem. This is not a problem per se. This is just how your body's naturally evolving. It's almost like when we take supplements, we don't say, oh, we're going to stop taking supplements.
Right. I mean, I'm taking vitamin C every day because I want my immune system to stay strong.
Exactly. But it's not because you have a disease.
But I don't have a disease.
Exactly.
And now in the HRT conversation, I like the fact that it's fortifying me. I like the fact that it's keeping me strong. It's keeping me healthy and vital. Like, brain functioning and body functioning. And I don't have to feel like, oh, it's just age. I'm going to go through the aging process. And it's not because I don't want to age gracefully. It's because I want to age in a way that allows me to live.
So when you were talking about Fortify, the thing that came to my mind, and we were talking about supplements, it's almost like if we can change our mindset and almost look at it as vitamin estrogen.
I love it.
Vitamin progesterone.
Vitamin estrogen.
Because then, if that was called that way, I'd be like, yeah, I'm going to be on it forever because it's a vitamin, right? It's not treating something. It's actually just elevating what's already there to its maximum capacity the way it was supposed to be. That's how we view vitamin C. That's how we view omega-3. That's how we view all calcium, everything. And we never say, oh, I'm going to have to stop taking omega-3 because I've been, taking it for 2 years.
I've been taking it for 2 years. My brain doesn't need it anymore.
Or what's going to happen if, about the dose. We never say that. So if we change and actually say vitamin estrogen, okay, well, that's just what my body needs to function to the highest capacity that it can.
Yeah.
Yes.
I want to live optimally.
I'm very happy that I'm on HRT. It's worked very well for me. So even through all of the drama of the period, but I will say that I am very happy I'm on it. It's worked for me. I know everybody's different and everybody should consider it with your own feelings, judgment, information, provider input.
And one thing, when Touseef says period, it wasn't a period. She had a bleeding episode.
Yeah, sorry. It just looked like a period, but it's not. It's a bleeding episode.
Yes.
Okay. Yes, a bleeding episode. But I'm very happy. So we'll see how long I'm with it. Maybe we can have another installment in the future if something changes or not, and just tap back in.
We'll tap back in. As always, we want you to embrace your body, embrace yourself, embrace perimenopause, embrace menopause. If you'd like to try HRT, then try it.
If you want to try vitamin estrogen and vitamin progesterone, you can try that.
Oh, Touseef.
And I love being fortified. I'm just going to end with that.
I love the fact that you love being fortified.
Yes.
Thank you for joining us on the Dr. Sophia ObGyn Podcast. Bye for now.
Bye.
Bye. This is general medical information based on my professional opinion and experience. For specific medical advice, please refer to your physician. Until next time, embrace your body, embrace yourself.